My name is Faris and this is Animated Anatomy. For a third time I will talk about the breasts, and this time about breast cancer. I will talk about the pathology, pathophysiology, prevention and treatment of breast cancer. In med school I had two colleagues who had to watch their mothers struggle and suffer with this disease, so I have personal reasons to make this video. I also want to raise the awareness because doctors usually recommend the mammography every third year. They're wrong about it. Want to know why they're wrong about it? Because whoever and whenever they made these rules, they also consider the financial possibilities of their state and clinic, and they always try to make the compromise between the money and your health. That's why I believe breasts need more attention, self and professional examination. So let's talk about the breast cancer. Breast cancer is cancer that develops from breast tissue. Signs of breast cancer may include a lump in the breast, a change in the breast shape, for example, dimpling of the skin, fluid coming out from the nipple, or a red part of the skin that peels off. All of these things can indicate a cancer. In those with distant spread of the disease, there may be bone pain, swollen lymph nodes, because the disease spreads through the lymph, mostly in the direction of the axilla, the armpit. There can be shortness of breath or yellow skin as well. Now if I zoom in here, I want to show you where the milk is produced, and that's exactly right here in these lobules of the gland. Then the milk goes through these ducts, and this is exactly where cancer develops. Well, most of the time. If the cancer develops in the duct, then it's a ductal carcinoma. If the cancer develops in the lobules, then it's a lobular carcinoma. In addition to this division, there are more than 18 other subtypes of breast cancer that I won't talk about. Now I will just say a few more words about the signs and the symptoms, how to recognize a cancer, and then I will talk about the things that maybe you are more interested in, and that's the way it spreads and how it spreads. And I will also explain the staging of the cancer. More than 80% of breast cancer cases are discovered when the woman feels a lump. The earliest breast cancers are detected by a mammogram. The lumps found in the lymph nodes located in the armpit, right here, can also indicate a cancer. You can also notice that, for example, one breast gets larger than the other. And if we look at the nipple, well, the nipple can change the position or shape, or even become inverted. Often there can be a discharge from the breast through the nipple. These things are not so hard to recognize, and if recognized and treated on time, it increases the survival rate incredibly. However, there is an inflammatory breast cancer that's a little bit more tricky to recognize and hard to diagnose. So if one of your patients reports that she has a lump growing, or she didn't notice it before, it's not a reason to panic, because fewer than 20% of lumps, for example, are cancerous. So if you're a woman and you're watching this video because you felt a lump under your breast and you're just browsing it to see what the hell is going on, well, you should not panic, that's for sure. Because, as I said, less than 20% are cancerous anyway. It does not mean you should ignore these signs. Even if it is a cancer, if it's just a lump, then you discovered it on time. Now remember when I mentioned that there are the cancers that start from the lobules here and the cancers that start from the ducts. Now cancer cells are crazy little cells that just want to replicate and reproduce without any order. However, some of them do show some signs and some order to a certain degree, and based on that degree we grade them. Those that are still good differentiated and they are similar to the lobule cells, for example, we call them low grade. Same goes for the ductal cancers. If they're somewhere in between, well, then they're intermediate grade, and as well we also have poorly differentiated cells, the cells that show very little similarities to the original cells, and we call this high grade. The main stages of the breast cancer are from 0 to 4. 0 is the precancerous or the non-invasive cancerous stage. The cancer cells are still within the original tissue and they did not invade other parts of the body and other tissues. Stage 1 to 3 are within the breast and regional lymph nodes. Not necessarily the lymph nodes, but they can be there as well. Now, stage 4 is the metastatic cancer that has a less favorable prognosis since this cancer escaped into the bloodstream. Those are the main stages, and we use the TNM system to describe the staging of the cancer. Now, if it's T1, then it means that the cancer is less than 2 centimeters. If it's T2, then it means that the cancer is between 2 and 5 centimeters. And if it's T4 stage, then it means that the cancer is bigger than 5 centimeters. The TNM system is also based on whether the cancer has spread to the regional lymph nodes, and that's N for the nodes. And as well, if it metastasized to the distant parts of the body. And before I finish, there is something really, really important that I want to mention, and that's the receptor status of a cancer. Basically, we have the estrogen receptor, we have the progesterone receptor, and we also have the HER2 receptor. Now, let's start with the last one. If the breast cancer does have these receptors, the prognosis is generally better. The cancer is actually more aggressive, but the prognosis is better because we can use these receptors to affect them with antibodies through the therapy. And yes, the cancer was more aggressive, but with the therapy, it's much weaker. Now, if the cells have estrogen or progesterone receptors, they can use these receptors, and with these hormones, they can stimulate their growth. However, if we use the drugs that inhibit the production of these hormones, we can actually reduce the growth of the cancer. So I already explained these ways to affect the growth of the cancer by blocking certain hormones or using the antibodies. You can also remove a whole breast if the cancer is spread that much. You can remove 1/4 of the breast or remove only tiny part of the breast or a small part of the breast if the cancer was small and the risk is small as well. And like in most of other cancers, you can treat it with radiation and chemotherapy. However, there is no standard way of treatment of the cancer. There are these options, yes, but it all depends from case to case. How much did it spread? Where did it spread? What is it sensitive to? And when you sum all of these things together, you should have a really experienced doctor to tell you what is the best treatment plan for you. Or if you're actually a medical student and not a patient, then you should be a really good doctor and to be able to say, okay, this is the best treatment plan, this way the patient will survive, or at least we hope. I tried my best to explain you breast cancer. You can also watch my video about breast augmentation or boob job here. You can also watch my video about breast anatomy here. If you like my lessons and want to purchase my software, then you can go to my website animatedanatomy.com. If you don't want to purchase my software, then at least you can subscribe here for new free content that I release regularly on my channel. Thank you.